What if erectile dysfunction isn't actually where the problem begins? For many men, difficulty getting or maintaining an erection is treated like an isolated sexual problem. But medically, the story can be much bigger. Your blood vessels may be involved, your nervous system may be involved, certain medications may be involved, stress and emotional health may be involved, and in some cases, persistent erectile dysfunction may accompany conditions affecting cardiovascular or metabolic health. So simply asking, how do I fix erectile dysfunction, may be the wrong first question. The better question could be, why is my body producing this symptom in the first place? And the first thing most people misunderstand is what erectile dysfunction actually means. One unsuccessful sexual experience does not automatically mean a person has erectile dysfunction. Stress, tiredness, emotional pressure, or other temporary factors can interfere with sexual function. ED generally refers to an ongoing difficulty getting or keeping an erection sufficient for sexual activity. That distinction matters. Because when someone experiences a problem once, panic can begin. Then something interesting happens. They start monitoring themselves. Will it happen again? Is something wrong with me? And now anxiety itself may contribute to the problem. Microhook. But psychological pressure is only one piece of the puzzle. Because an erection depends on several body systems working together. Think of erectile function as the result of several biological systems communicating correctly. The brain has a role, hormones have a role, nerves have a role, blood vessels have a major role, and emotional state can influence the entire process. That means disruption somewhere in this chain can contribute to erectile dysfunction. Conditions affecting blood vessels, nerves, or hormones are among the recognized physical causes. This is why looking for a single explanation can be misleading. And one part of that chain deserves special attention: the blood vessels. Because this is where erectile dysfunction can sometimes reveal something people were never expecting. Blood flow is essential to normal erectile function. So conditions that damage or narrow blood vessels can affect erectile function too. And that brings us to one of the most important facts in this entire video. If erectile dysfunction becomes persistent, ignoring it and focusing only on performance could mean overlooking a broader health issue. Atherosclerosis, diabetes, high blood pressure, and other health problems affecting circulation or nerves can be associated with ED. In a moment, I'll explain why this connection can completely change how erectile dysfunction should be approached. But first, we need to destroy one major myth. You've probably heard that's just what happens when men get older. Not exactly. Erectile dysfunction becomes more common with increasing age, but aging itself does not mean ED should simply be accepted as inevitable. Why does age appear connected? Because health conditions that can contribute to ED, such as vascular disease, diabetes, and other chronic illnesses, also become more common as people get older. The important distinction is this: age may increase risk, but persistent erectile dysfunction can still deserve medical evaluation. But age isn't the only thing blamed incorrectly. Another common assumption is it must be low testosterone, and that's where things become more complicated. Hormonal problems can contribute to erectile dysfunction. But ED is not automatically proof that testosterone is low. Remember the biological chain we discussed: brain, nerves, blood vessels, hormones, emotional health, medication effects. A problem involving any of these areas may contribute. So guessing at hormones without proper evaluation can distract from the actual cause. And there is another cause people frequently overlook because it may already be sitting inside their medicine cabinet. Certain medicines can contribute to erectile dysfunction. That's one reason medical evaluation includes reviewing medications and overall health, not just asking about sexual performance. But this does not mean someone should suddenly stop a prescription medicine. Changing medication should be discussed with a qualified healthcare professional. Now we're getting to the part many people miss completely. Suppose the heart appears fine. Suppose hormones aren't obviously the problem. Suppose no medication explains it. Could the brain still create a very real physical problem? Yes. And understanding this explains why some people experience ED in certain circumstances but not others. Mental and emotional factors can cause or worsen erectile dysfunction. Stress, anxiety, depression, relationship concerns, performance pressure. These aren't imaginary explanations. The brain is directly involved in sexual response, so psychological stress can interfere with physical function. And here's where a feedback loop can form. One difficult experience produces anxiety. Anxiety increases pressure during the next experience. That pressure creates another difficulty. And the second difficulty appears to confirm the person's fear. But psychological explanations shouldn't automatically be assumed either, because persistent ED may deserve something more objective, a medical assessment. This is where many people imagine an embarrassing conversation and decide not to seek help. But clinically, ED evaluation is much broader than that. Healthcare professionals may review medical history, sexual and mental health history, perform a physical examination, and use laboratory or other tests when appropriate. They're trying to answer questions such as, could circulation be involved? Could nerve function be involved? Could another medical condition be contributing? Could medication be affecting function? Could emotional health be playing a role? The goal is not simply to label the symptom, it's to understand why it's happening. And once the cause becomes clearer, treatment suddenly becomes much more logical. Because there isn't just one ED treatment. And this is where online advice can become especially misleading. Because what helps one person may make little sense for someone whose ED comes from a completely different cause. Here's the question to remember. Are you treating the symptom or treating what created the symptom? That distinction changes everything. Because legitimate medical treatment can range from improving underlying health and addressing psychological factors to prescription treatments and other medical options. And there's one treatment mistake that can actually become dangerous. We'll get to that shortly. Treatment is individualized. When possible, healthcare professionals first address underlying causes. Lifestyle changes may be recommended. Counseling may help when emotional or psychological factors are involved. Prescription medication can be appropriate for some adults. Other medical treatments also exist when first-line approaches aren't suitable or don't work. This is why the internet's obsession with finding one miracle solution misses the point. Different causes require different strategies. And before someone even gets to medication, there are several health factors worth examining. Lifestyle isn't a guaranteed cure, but habits affecting cardiovascular and metabolic health can also influence ED risk. A healthy eating pattern, regular physical activity, maintaining healthy cardiovascular risk factors, and avoiding smoking can support overall vascular health. NIDDK notes that healthy dietary patterns may lower the risk of developing ED or improve symptoms in some people. The reason is straightforward. Erectile function doesn't exist separately from the rest of the body. But now we need to discuss the mistake I warned you about earlier, because just take a pill is not safe advice for everyone. Some prescription medicines interact with medicines used for certain heart conditions, and that is exactly why self-treatment can be risky. Certain medications should not be combined with nitrate medications used for heart problems, because the combination can cause dangerous cardiovascular effects. So if someone remembers only one treatment lesson from this video, remember this: medical history matters before medication. And now we reach perhaps the most important question of all. When should someone actually see a doctor? An occasional difficulty can happen, but when erectile problems repeatedly occur, cause concern, or affect quality of life, medical evaluation is appropriate, especially because the objective isn't just restoring sexual function. It may also be identifying something else affecting health. That's the mindset shift. Instead of, "This is embarrassing," think, "This is health information." Your body communicates through symptoms. The smartest response is not shame, it's investigation. And once you understand that, the biggest myth surrounding erectile dysfunction finally collapses. Erectile dysfunction isn't one disease with one cause and one cure. It's a symptom that can emerge from different biological and psychological pathways: blood vessel disease, diabetes and metabolic problems, nerve problems, hormonal issues, certain medicines, stress and emotional health, or a combination of factors. Which means the most intelligent approach isn't chasing the fastest solution. It's identifying the underlying problem. So the next time you hear someone describe erectile dysfunction as simply an age problem, testosterone problem, or performance problem, remember, the human body is far more connected than that. Persistent ED deserves proper medical evaluation because treating the underlying cause can matter for both sexual health and overall health. If this video helped you understand what's really happening beneath the surface, subscribe for more evidence-based men's health explanations. And watch the next video because we're breaking down the everyday habits that can quietly affect male sexual health and which popular claims are actually myths. That video is on your screen now.